The Centers for Disease Control and Prevention, CDC, has dropped its travel health notice for cruising, just over 2 years after the COVID-19 pandemic began. The change is the culmination of 6 weeks of quickly ratcheting down COVID-19 warnings for cruising. On February 9, CDC released guidelines for a new voluntary COVID-19 program for cruise ships but kept cruising at the top level for travel notice, signifying very high risk and avoid travel, where it had been for months. Then, less than a week later, the agency lowered the cruising risk assessment to a level 3 high risk notice. About 2 weeks ago, the CDC lowered the risk assessment again, to a level 2 moderate risk notice. There may no longer be a formal travel health notice for cruising, but the agency stresses that cruisers should be up to date on their vaccinations. That means booster shots for those who are eligible. The CDC continues to recommend that people who have not received a booster shot should avoid cruising. As of today, about 65.4% of the total U.S. population has been fully vaccinated, but about half, 49.8%, of those who are booster eligible have not yet received a first booster dose, according to CDC data. This week, the Food and Drug Administration, FDA, greenlit a second booster shot for people ages 50 and older, after data emerged indicating a first booster wanes in effectiveness after 3 to 6 months. Dropping the health notice is not the same as saying that cruising is risk-free. The virus that causes COVID-19 spreads easily between people in close quarters on board ships, according to the CDC's webpage on cruising. If the virus is spreading on board a cruise ship, passengers and crew are at risk for infection, even if they are up to date with their COVID-19 vaccines. Since peaking in mid-January, the number of recorded daily COVID-19 infections have plummeted in the United States to about 8% of what they were. But the country is still recording roughly 3,800 deaths from coronavirus every day, which is an uptick from just a few weeks ago.